Hi, this is Annish. I'm here again today to talk about your mental health. I will never get tired because I know someone out there needs this. Before I go further, I just want to say that I'm not a blogger. I am just a compassionate mental health provider, and I'm just here to encourage someone about mental illness. So please share my videos, likes, comment. You don't know who might need this. A few days ago, someone called me and was telling me that they had a funeral and his friend's auntie committed suicide in Sierra Leone. This is West Africa. Because sometimes we think that, okay, if you don't have the means, like maybe you don't have a gun or something, you still cannot go ahead and commit suicide. You can. So suicide is everywhere. It can affect anybody. Mental illness or anxiety or depression can affect anybody. None of us are immune to it. Neither me, you, whether you're white, black, we are all, susceptible to any kind of mental illness. So I'm here today to just talk about the realities of mental illness. It is real, it is here, and it's not going anywhere. It all depends on us to either embrace your mental health or allow it to go to the worst. But my purpose here is just to encourage everyone out there, including myself. I am not excluded. I feel anxious sometimes, I feel depressed sometimes, but depend on how you tackle it. So it's not like I'm perfect. I'm here to say that, oh, you have depression, you have anxiety, and no, I am not immune to it. I've been affected with, I've been depressed before, I've been anxious before. We're still battling and coping with depression and anxiety. But let me tell you the truth. The third most common mental illness is anxiety, depression, and PTSD. And I'm fortunate to, learn from a provider, to precept from a provider, and I see patients every day. And I'm telling you, 90 or 80% of those patients are anxiety in this, some kind of anxiety in depression. So it is real. Anxiety and depression are the common mental health condition that can significantly impact your daily life. So here are some key points about their realities. Symptoms can often manifest as excessive worrying, restlessness, and physical symptoms like increased heart rate, depression may present as persistent sadness, fatigue, and lack of interest in activities. Like the activities that you love to do, you're no longer interested in it, then you need to talk to someone. Some of the overlaps of these anxiety and depression, many individuals experience both anxiety and depression simultaneously, which can complicate diagnosis and treatment. Some of the causes for both conditions can arise from a mix of genetic, so sometimes it can be genetic, that is like it's in your blood, and sometimes it's environmental, and also psychological factors like stressful life events, trauma, and certain medical conditions also can contribute to anxiety and depression. The impact. This condition can affect your relationships, your work performance, your overall quality of life. They may also lead to some health problems if left untreated. So that is why I'm urging anyone out there, if you are experiencing any kind of sadness, anxiety, and depression, seek help. Effective treatments include therapy such as cognitive behavioral therapy, medication management, which is you can treat with an antidepressant medication, anti-anxiolytic, which is like anti-anxiety. And you can also treat anxiety depression with SSRI, which is serotonin reuptake RI inhibitors. Yes, serotonin reuptake inhibitors, SSRI, which are very, very effective. It has proven to be more effective in treating depressions and anxiety. And also, lifestyle changes too. You can do exercise, mindfulness. Like the other day, I was saying that sometimes when I feel anxious or depressed, I watch movies, funny movies that make me laugh and lift my spirit up. And I've been doing that for years before I even became a nurse, before I even knew about what anxiety and depression is. Sometimes I just love going to YouTube, type funny videos, maybe animals jumping or dancing, and I will laugh and laugh and laugh. And it's therapeutic. So the stigma, involving mental health is there is often a social stigma around mental health, which can prevent individuals from seeking help. But I'm here to announce to you, just like I said in the beginning of the video, that mental health can affect anybody. Mental illness can affect anybody. It doesn't discriminate whether you're black or white, rich or poor. So don't be afraid. Don't be discouraged. Don't be sad because you are being diagnosed or you're going through some kind of mental illness. Seek help. Ask for support. And by the grace of God, you will feel yourself again. Support from friends and family and mental health professionals is crucial for recovery. You need support. You know how back in the days, like when you are down, that time I did not even know anything about anxiety and depression or any medical terminologies. But when you speak to your favorite family member, speak to your favorite friend, or you just light up. You just feel like all the heavy burden has been lifted up. That is therapy, but we don't know it. So support is very important in the journey of mental health. Okay? So I'm going to leave it this way. And remember, your mental health is as important as your physical health. Don't take it lightly. Please, seek help. I am here. I work. I'm a little bit busy, but I'm available and I can help you point to the right direction if you live in the United States. But if you're also in somewhere in Africa, Asia, or in any part of the world, I believe there's help everywhere and there's crisis line everywhere. But in the US, if you know anyone or you or your loved one is suffering from any kind of anxiety or depression and feel like you want to end it all, you can call the national helpline You can call National Helpline on 988, or you can just Google National Crisis. They have so many numbers and so many resources available. Please don't throw in the towel. We're in this together. You're not alone. And don't think that anxiety and depression or whatever you're going through is the end of the world. Or maybe you're unfortunate you're going through now. Like I said earlier, these diagnoses, these diseases, they don't discriminate. They can affect anyone at any point in your life and at any age. So please, I want you to be safe out there, and everything will be okay by the grace of God. So take care and have a nice day. You can follow me on YouTube, Instagram, Facebook as Nurse Annish. This is vital information. This is no gossip or anything. This is just giving you the realities of life and encouraging someone out there. All right? I leave you in peace. Have a blessed day and take care of your mental health. Thank you.